Expanded new guidelines for treating stroke patients has been called a game changer that will save lives.
Health reporter Stephanie Stahl is here to explain in tonight's Einstein Healthcare Science Center report.
Doctors are really excited about this. You know, these new guidelines that expand the time frame for treatment mean more people could be eligible for life-saving interventions that can minimize or prevent permanent damage. So now, 1 out of 3 stroke patients could fully recover, according to scientists.
I'm a wife to my husband, I'm a mother to my children, I'm breathing, and that's absolutely to be celebrated.
9 months ago, Cindy Dodd suffered a massive stroke while she slept. She woke up paralyzed on the left side of her body. Doctors feared she'd missed the critical window for treatment, 4 hours for a clot-busting drug to be effective and 6 for surgery.
I know I'm supposed to be dead. Like, I knew I should have died, and I knew I was lucky to have the procedure. It saved my life.
Cindy was part of a clinical study where doctors used scans of her brain to determine if surgery might still be an option even hours after the stroke.
Some small part of the brain typically dies. It really is irreversibly injured. It's not going to come back. But there's a larger area of brain that surrounds that that's called the penumbra, which is tissue that is at risk of dying if the blood vessel that's blocked isn't opened up.
These scans of Cindy's brain, one taken before the surgery, the other after, show how doctors were able to restore the flow of blood to the area damaged by the stroke.
When you can take a patient who you know will be severely disabled and possibly dead, do a procedure that can be done within as fast as 12 to 14 minutes, and then have them make a recovery that lets them lead a near normal life or even a completely normal life, that's unbelievable.
Now, new guidelines from the American Stroke Association expand the golden window for stroke treatment from 6 to 24 hours. And about 300 hospitals around the country use that new automated brain imaging software called Rapid to identify stroke patients who may be candidates for this treatment in this newly expanded time frame. Doctors are saying this is remarkable, and it is.
It's incredible. And you think about people that live in rural areas that can't get to a hospital that quickly. This is life-saving potentially.
Exactly.
All right, thanks, Steph.
Thanks, Steph.
Uh-huh.
Well,